Lyme disease, understanding the symptoms, prevention, and treatment. Lyme disease is a serious health threat that affects millions of people each year. It's caused by a type of bacteria called Borrelia burgdorferi, which is spread through the bite of infected ticks. Understanding the symptoms, prevention and treatment of Lyme disease is essential for safeguarding your health. Early diagnosis is key for successful treatment, and it's important to be aware of the signs and symptoms of the infection. By taking the necessary steps to prevent Lyme disease, such as avoiding contact with ticks, using insect repellents and wearing long-sleeved clothing, you can reduce your risk of infection. If you do get infected, there are a number of treatments available to help manage the condition, ranging from antibiotics to natural remedies. With the right treatment and prevention strategies in place, you can enjoy life without worrying about Lyme disease. What is Lyme disease? Lyme disease is a bacterial infection caused by the bite of an infected tick. Once infected, you may not notice symptoms for months or years. In fact, most people with the disease don't receive proper diagnosis. During this time, the infection may worsen, resulting in serious complications such as arthritis, heart disease and nervous system disorders. Lyme disease has become a serious health threat because it has become increasingly common. Since the late 1970s, the number of reported cases has risen steadily. While it is still rare in most parts of the country, the Centers for Disease Control and Prevention (CDC) reports that Lyme disease is more common now than it was 30 years ago. The infection is most common in the northern and midwestern regions of the United States. Symptoms of Lyme disease. Lyme disease can have a number of symptoms, including anemia. Anemia is an abnormal condition in which your body does not produce enough red blood cells or hemoglobin, the protein in red blood cells that transports oxygen to your tissues. You may feel dizzy or weak or experience shortness of breath due to anemia. Arthritis. An infection may cause inflammation in your joints, particularly in your knees, wrists and spine. Nervous system disorders. This includes a variety of nervous system disorders, including headaches, tingling sensations in your hands and feet, and seizures. In addition, Lyme disease may also cause extra symptoms such as low blood pressure. This occurs when an infection weakens your blood vessels, causing your blood pressure to drop. This can be dangerous if it is not treated. Preventing Lyme disease. The best way to prevent Lyme disease is to avoid getting bitten by infected ticks. In addition to avoiding tall grass and shrubbery, where ticks may be hiding, you should also be on the lookout for signs of nearby ticks. Keep in mind that ticks may be more common in warmer months, so pay attention during summertime. Additionally, avoid areas where wooded areas meet grassy areas, as in these areas, ticks are more likely to be found. You can also reduce your risk of getting bitten by wearing long-sleeved shirts and pants and applying SPF-coated insect repellents when outside. When possible, walk in groups of 2 or more and use an insect repellent that contains DEET. Diagnosis and testing for Lyme disease. The best way to prevent Lyme disease is to avoid infected ticks. The CDC reports that roughly 25% of people who get bit by an infected tick don't realize it. Once infected, you may not notice any symptoms for months or even years. This can make it difficult to find a diagnosis, particularly as the disease progresses and you begin to experience more serious symptoms. The only way to diagnose Lyme disease is if you get tested at an accredited lab. The testing process involves collecting a sample from your blood, which is sent to the lab for testing. If the test is positive, the disease is indicated by a positive result. Treatment options for Lyme disease. If diagnosed and treated early, Lyme disease can be successfully managed. There are a number of treatment options available, including antibiotics. These are the most common treatment for Lyme disease, as they attack the bacteria that cause the infection. How long to take? The treatment schedule is different for everyone and depends on your age and medical history. Generally, antibiotics are taken for a period of 2 to 4 weeks, but it may last longer for some people. Side effects. Some people experience mild side effects from antibiotics, such as nausea and a slight decrease in your appetite. More serious side effects such as an increased risk of stomach ulcers and kidney damage may occur in a small number of people. How to manage Lyme disease symptoms. If you have Lyme disease, your physician may recommend taking antibiotics, which are the main treatment option for the condition. If you suspect that you have the infection, you should see a doctor immediately. You should also seek treatment as soon as possible, as early diagnosis is key for successful treatment. Follow these steps to manage your symptoms: eat a healthy diet and avoid caffeine, alcohol and sugar, which can affect your sleep. Exercise regularly and drink plenty of water, which help boost your energy and keep your body hydrated. Keep your stress levels low and maintain good sleeping habits by avoiding sleeping pills, caffeine and alcohol. Keep your infection controlled by taking your antibiotics correctly and following the recommended treatment schedule. Keep your symptoms under control with self-care measures, such as taking your medication. Natural remedies for Lyme disease. The best way to treat and prevent Lyme disease is to avoid getting infected in the first place. Follow these tips to minimize your risk of getting bitten by a tick. Avoid wooded areas where ticks are more likely to be found. Use insect repellents that contain DEET when outdoors and follow the product directions. Use a repellent that is approved for protecting against ticks on your skin and clothes. Make sure your pets are vaccinated and follow pet care guidelines, as ticks can be found on pets as well. Common complications of Lyme disease. If left untreated, Lyme disease may cause serious complications, such as encephalitis. This is an inflammation of the brain, causing symptoms such as headaches, dizziness, confusion and altered consciousness. Heart disease. The risk increases with the longer you have had Lyme disease, as well as the more severe your symptoms. This condition can lead to heart disease, heart failure and even sudden death. Seeking medical help for Lyme disease. If you are diagnosed with the infection, you should immediately begin treatment. You should also inform any family members who may have been exposed to ticks. Patients with untreated Lyme disease may experience a range of serious health problems, including cardiac disease. This can cause irregular heartbeats and even sudden death. It can develop months or even years after the initial infection. Facial palsy. This occurs when the facial nerve is damaged during treatment or during recovery. This can cause a variety of symptoms, including drooping eyelids, a drooling mouth and facial paralysis. In addition, untreated Lyme disease may cause additional symptoms, such as headaches. These may be caused by the infection or a side effect of treatment. Low blood pressure. This can be dangerous if it is not treated. Preventing Lyme disease in the future. The best way to prevent Lyme disease is to avoid getting infected in the first place. The CDC reports that roughly 25% of people who get bit by an infected tick don't realize it, which can make prevention particularly challenging. The best way to protect against Lyme disease is to avoid tall grass and wooded areas where ticks are most likely to be found. You can also wear long-sleeved shirts and pants when outdoors and use an insect repellent that contains DEET when outside. Preventing Lyme disease in the future is especially important for children and teens, as they are likely to spend more time outdoors and be less likely to follow recommended precautions. That being said, the infection can be successfully managed with early treatment, so even those with later developing complications can successfully manage their condition. Summary. The disease Lyme disease is caused by a type of bacteria that is spread through the bite of infected ticks. The infection can be difficult to diagnose, as symptoms may be difficult to identify in the early stages. Lyme disease can be successfully managed with early diagnosis and prompt treatment. The best way to protect yourself against Lyme disease is to avoid tall grass and wood from wooded areas where ticks are most likely to be found.